My name's David Adamson. I'm a reproductive endocrinologist and surgeon. Grew up in Toronto, Canada, did all my training there, and then I went to Stanford in California to finish my fellowship. Went into a practice by myself, then started an in vitro fertilization clinic that I built up over 25 years and sold to Palo Alto Medical Foundation. I'm a clinical professor at Stanford and UCSF and have about 300 publications in the medical literature. They're around infertility, IVF, but also endometriosis and a lot of work around quality of care, standards of care, cost-effective care, how to measure outcomes, and also really around access to care. I've been very privileged to be president of a number of major organizations: American Society for Reproductive Medicine, Society for Assisted Reproductive Technology, and AAGL, which is the surgery organization, as well as a number of other organizations. I'm president of the World Endometriosis Research Foundation, which has 63 centers around the world. We started with Oxford and Harvard that collect both information and also specimens, tissue and blood specimens in a standardized fashion so that we can use this information and these specimens in big data research to try to understand endometriosis better. And I'm also chair of the International Committee for Monitoring Assisted Reproductive Technology, or ICMART. And we are the smallest NGO at the World Health Organization. We have a board of 6 people. And I been involved with that for 25 years and founded ICMART in 2003. And we collect the global in vitro fertilization outcomes every year, number of cycles and babies born, et cetera, from countries all over the world. And then we analyze and publish the results on that. And also have worked on 3 glossaries that standardize several hundred terms in reproductive medicine. So I've been very fortunate in my professional career after selling my clinic to Palo Alto Medical Foundation in 2013. I stayed on and practiced medicine still for a few more years, and then turned my attention completely to a company which is my day job now, that actually founded in 1997. The company is called ARC Fertility, and we're really committed to increasing access to quality infertility care. Fertility care is how we started. We now provide care across women's health spectrum and also for men's health. The company was started to increase access to quality, so we built a network of top quality doctors across the U.S. We have 25% of the physicians and clinics in the United States that provide 1/4 of all the IVF sites in the U.S. In our network. We don't own the clinics. We have agreements with them to practice evidence-based medicine and packages at a slight discount. And because of this, we get superior outcomes. The medical care is also supported by a very robust fact-based digital system with apps and concierge navigation that leads into our IVF clinics, and then all the supplies and services around them, including drugs and genetics testing and donor sperm and egg and embryos. And we also provide within our ecosystem of care preconception testing for women and for men, and pregnancy support, return to work support, early child care, lactation support, menopause, and also men's and sexual health. So a very comprehensive ecosystem. Having started the company in 1997 in the direct-to-consumer space, we brought the quality, as I mentioned, with top quality doctors, evidence-based care, but we had to address affordability because in our healthcare system and indeed around the world, especially with infertility, affordability, which is the out-of-pocket cost relative to net disposable income, is a major barrier to care. And globally, probably about 1 person in 10 gets the care they need with infertility. In the US, it's about 1 in 4. So there's still a huge gap. And to address the affordability, we do get a bit of a discount from our doctors. Our pricing is about 25% lower because We do evidence-based care and avoid waste and don't put what are called unnecessary add-ons into the picture. We work with multiple lenders to get unsecured loans for patients who are in the direct-to-consumer market so that they can afford their fertility care. And then about 2020, we transitioned the company not just in the direct-to-consumer space, which we continue to work in, but we also went into the employer benefit space, and that's where the future of ARC is. And the future is there because so many more employers and society are recognizing how important reproductive health is and fertility care. And so many more employers are providing benefits. So we brought a very innovative program to employers because you have to make it affordable for them. They have real budget issues and concerns, need to see an ROI. And so the innovative pricing in our program is that we charge no implementation or access fees and no per employee per month fee, which is very different in the healthcare system in the US. And the employer also only pays a subsidy when an employee actually uses a benefit, and then they only pay as much as they want. And so an employer doesn't have to cover the entire cost of care that the member needs. They can provide the amount that they can afford. And then we supplement that with our direct-to-consumer lending through multiple lenders. And so by having the clinics take a little bit of a discount, they can afford it. The healthcare system can afford it. We get a lower price for the patient and a set price so we can get them money. We can borrow money, so it makes it more affordable for them. And then we make it very flexible with the employer. They can choose what they want to include or not and how much of a subsidy they're going to pay or not. And then we have a very low utilization fee for them. So we make it much more affordable for them. So the care comes in with better outcomes at 25% less money. And so this is my day job now, although I continue to do a lot of my nonprofit work. And we're working hard to move the company forward. It's a very challenging investment climate now as I'm out looking for funds so that we can really grow our company. We're working with all the major brokers. We are preferred vendors with a number of them, including Marsh and USI and Brown & Brown with national agreements. And we have really moved into the Taft-Hartley union space, credit unions, and teachers unions, which find our pricing model very, very attractive because they can implement the program at no cost. So we have a lot of opportunity in an area that's supposed to expand 8 to 10 times, but we're at a point now where we're really looking for capital, growth capital, and operating capital, so we can really take the company to the next level. So that's my probably full life story, except for the fact I've been very happily married for 52 years and 3 kids and 5 grandchildren, a 6th one to show up within a month, and a dog, Sergeant Pepper, who's a standard poodle. My wife and I have lived here in Silicon Valley for a long time, and because all of our kids now have homes in Denver, all 3 of our kids have homes in Denver, we're actually just in the process of selling our house, which we'll do in the next month or so. And we're going to move to Denver, Colorado, where our kids all live.